Hi, it's Dr. Dahabra. Today we're going to be showing you how to do the vampire facial and the vampire facelift. So the first step is taking the blood from the patient. Alright, to find the good veins. Looks to be a good vein. Alright, a little pinch. Okay. Get the first few. Got the second one. Three, four. Almost done here. Okay, so that's the blood. And start spinning them. Okay. While it's spinning, I'd like to. Spinning would like to start with microneedling while the blood is in the centrifuge, and this will prepare the patient as well. We have different serums we can use. One with vitamins, anti-aging serums for lightening, so we can use different ones depending on the need of the patient. This is the Cosmo pen we use. With the Cosmo pen, it has different depth and different speed as well. So we'll start with number 2 speed and 1 millimeter, and then we'll see how the patient tolerates this. Try to go in different direction. When I'm doing the microneedling, I like to go to the areas where the body tends to form like soft and bigger wrinkles, like around the mouth, the nasolabial folds, the smile lines. These areas usually tend to form wrinkles before other areas in the face. So I focus on these, and especially if the patient has certain areas that they would like to focus on, of course, then we address it more than usual. Okay, so now we spin the blood. We have the 2 tubes, and you could see this is PRF actually, not PRP. That's why it's blood tinged. The speed time and the spinning speed is lower, so it catches actually more red blood cells and more platelets and growth factors. So it's superior treatment to the PRP. PRF is way superior. We got the patient's PRF, the plasma rich fibrin, and now we're gonna apply it to the skin, and then we're gonna do the microneedling with the PRF, patient's PRF. As I said, the PRF is way superior to the PRP. It has way more platelets and growth factors and stem cells and a little bit of red blood cells. That's why it's red tinged. And it's not yellow. For the whole face with the PRF, Okay, we want the depth that the patient could tolerate, and then we focused. You can see the erythema on the smile lines and the places where the body tends to form wrinkles. We focus on these areas. That's why you see these areas here a little bit more red around the mouth, nasolabial fold, the forehead, around the eyes, under the eyes. You know, these places sometimes you cannot actually treat with other modalities. Some of the areas, like under the eyes, for example. So now we finished the the vampire facial, and I'm gonna show you the vampire facelift. With the vampire facelift, you get the patient's plasma, the PRF, or and then you can use the filler or just use the plasma fibrin itself, and it acts as actually as a filler by itself. It's natural, so some patients actually prefer that over artificial fillers, but they don't last as long. But you know the advantage of that is that it treats the skin as well. So we can do the same places as any filler, a little pinch for the nasolabial fold. We can fill this area. Aspirate, negative, then inject. You can see already nicely filled. The same side, the other side, I mean, do the same. As we withdraw, we inject more. Okay, that's good. A lot of patients also would like to treat the marionette lines and the corner of the mouth, so we can fill this area a little bit here to turn the corner of the mouth up and to fill the gap around the marionette line to conceal it. Okay. Cheeks, fill a little bit in the cheeks. The other side, the same place, same depth, same amount, because we're starting with symmetry, so we keep it symmetrical. Let's see. That's about it. Vampire facial, and then we did the vampire facelift with the patient's own PRF and fibrin. We filled the cheeks here, and then the nasolabial fold, and a little bit in the marionette lines at the corner of the mouth, and that was everything.
Good.